So stem cells are cells in our body that basically make all the other cells. So they can turn into skin, they can turn into muscle, they can turn into cartilage, which cushions our spine, they can turn into knee cartilage. And so what those cells do is when we put them in certain areas of the body, they turn into those cells and they actually repair the disease process. They're also very powerful at decreasing pain and inflammation. So when they start repairing the problem areas, they'll actually turn off the pain signaling pathways, which is very wonderful for the patients.
Here at Trinity Spine Center, your stem cell therapy is much different than others. Explain.
So we utilize the patient's own stem cells, which is called autologous stem cells, as opposed to cadavers. So a lot of the programs that are out there will use patients' cells that they've harvested from people who've died, and there is a risk of disease transmission with that. Whereas with our own stem cells, there's no risk of disease transmission, and those cells are already set up to work on our own body, so there's no immune response that might kill those cells off.
How does stem cells or stem cell treatment benefit someone with back pain?
So back pain is usually due to the fact that the discs and the joints in the spine start to wear out. So the cartilage, which is the cushion in our spine, starts to wear out over the years from a lot of reasons, being overweight, heavy labor jobs, smoking, things like that. And so that will cause pain. So what the stem cells do is they turn into the cells that make the cartilage and they replenish the cushion inside of the spine. And that slows down and stops the disease process and also turns off the pain response.
Here at Trinity Spine Center, your stem cell therapy is much different than others. Explain.
Stem cells are in our bone marrow, and so many centers will say they do stem cell treatment, and what they do is they take out the patient's bone marrow and they spin it down in something called a centrifuge, which separates all the cells. And if they have a certain amount of bone marrow that they harvest for the patient, they'll get a very small number of stem cells. At Trinity Spine, we have a stem cell research lab, and that lab actually takes the stem cells, separates it from the bone marrow, and actually those cells then are now triggered to basically repair the spine. They actually will grow inside the patient, and they will actually improve the cartilage and discs in the spine much better than just taking the cells out and putting them back in with a very small number.
How do you perform a stem cell therapy? Is it through a needle? How do you remove them?
Yeah, the wonderful thing about it is there's no surgery for it. A needle removes the cells from the bone marrow area, which is really a quite painless procedure, and if people are anxious, we give them something to help them with the anxiety, like a twilight sedation if they'd like. And then after that, the cells go to the lab processes the cells, and then the patients will have the cells put back into the areas where the disease is, like the discs or joints in the spine, and that's also with just a small needle.
And how soon do people see results from stem cell therapy?
So the cells will grow the tissue back. They'll repair the disc over about a 6-month period, but they'll turn off the pain response within a few weeks. So a lot of patients within 2 to 6 weeks will start seeing reduction in their pain, and then their discs will actually start growing back over about a 6-month period.
Is the field of stem therapy, is that still, it's evolving, right? It's kind of new.
Absolutely, absolutely. So stem cells have been used in treatment of cancer for about 10 years or so. And then now we've found over the years that we can actually have these cells regenerate different parts of our body. So there's work in heart disease, there's work in diabetes ongoing, in spinal cord injury. And so over the last few years, our PhD, who's the chairman of the World Congress on Stem Cells, has found that he can actually regenerate the disc material with the stem cells without even doing any manipulation of the cells, just basically purifying them. And so that's an ever-evolving field. And the nice thing about our program is that we'll use the patient's own stem cells and that they should be able to grow those discs back over years, and we can hold on to their cells as well in the freezer for them. So if the disc starts to degenerate again over time, we can inject them again. So.
How do your doctors stay up to date on the latest advancements?
So as I said, our PhD is one of the world's experts in the stem cell field. So he's basically writing the book on this. Our surgeons, Dr. Hayes and I, as I said, we go to national meetings and present the research. So we're really at the cutting edge of stem cell use in the spine. And that's kind of how we stay up to date on this. Yeah.
Dr. Siddiqui, what is your success rate through stem cell therapy?
So in our animal research, we find that 100% of discs regenerate with the stem cell treatment. Humans, of course, are a little bit different. They like to be active, and they like to sometimes smoke cigarettes and things like that. So the success rate drops a little bit in humans, about 70% success. However, surgery in the spine for back pain is probably only 60% successful for back pain alone. So the stem cell success rate is actually higher with far less risk.
If someone watching this now has back pain, they're more curious about this process, can they come see you directly?
Absolutely. I'd encourage them to come in, have an examination with us. We'll go over all of their imaging with them and see whether they're a candidate or not. The wonderful thing about this is that it's so minimally invasive. Almost everybody is a candidate, and we could possibly help them.
Guess what? There are about 60,000 miles of blood vessels in the human body. Your health matters. Stay tuned.